My name is Josh Barningham. I am 36 years old and I live in Albertville, Minnesota. The pain for me started about 10 years ago is when it started to get bad. The cause behind the pain is just genetics. I have degenerative disc disease, so it's nothing specific. Just my body was just deteriorating.
When we first started dating, he was working construction, and this is before his back started deteriorating really bad. So I've seen him really good, and then it just gradually, in the last 3 years, really gotten bad.
The pain definitely affected my family and friends. My family especially, because everything I couldn't do, they had to. My wife especially was doing everything. Everything around the house, everything for our daughter.
It was tough to see, and especially he wanted to be a father so bad and not be able to be the father that he wants to be because he just is in so much pain.
For pain treatments, I have tried everything, from medications, of course, chiropractic care, massage therapy, physical therapy, acupuncture. If there was a possibility for pain relief, I tried it. Some stuff worked, some didn't, but nothing was enough. Well, they put the stimulator in on December 22nd, 2014. Since about 3 seconds after they turned it on, I was feeling better. I actually worked a 14-hour day on December 23rd. So it's immediate relief, instantaneous. They flipped the switch and I felt immediate relief.
Since Josh had the stimulator put in, he's able to really be the father he wants to be and be able to get down on the floor and play with her and pick her up. When she crawls over to him and she wants to be picked up, he can pick her up now.
It's a light switch for one. It's not something that takes a long time to kick in. It's instant. And if it does work for you, it's gonna be, it's night and day.
He has definitely, emotionally wise, been just happier, more upbeat. He has a little pip in his step now. He is a different person now that he can actually not feel like a burden to people, and he can actually enjoy himself, and he can make it through the day without being in so much pain.
One of my favorite things was just to go hang out with some friends at my friend's shop and tinker on some of the toys that he's got, some cars, big mud trucks, and just kind of hanging out and turning some wrenches. Just to spend an hour hanging out at the shop with Nate and Dell it's one of the little things you don't really realize, that how important it is to just sit and talk with friends when you can't, when you are stuck in a recliner or stuck in your house for weeks and weeks on end because you can't hardly walk and move around, and you don't realize how much you like that kind of stuff until you can't do it. When I recently was talking to my doctor about my success with the neuro stimulation, the first thing I said was, I wish a doctor would have at least tried the test 5 years ago. My life would be completely different now.
As my husband, I watched him go through it, and I had to trust that he was making the right decision, that he really felt it was going to make a difference in his life, and it has. It's worked tremendously.
These are actual patient stories. The stories are the experience of these individuals only. Although these patients did not experience complications, there can be risks and potential complications associated with the use of medical devices. If you are interested in learning more, please consult your physician. CE marking does not necessarily indicate regulatory approval status for all markets. Please refer to the instructions for use for a full listing of indications, contraindications, warnings, and precautions. RX only. Brief summary. Prior to using these devices, please review the instructions for use for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. Indications for use. Spinal cord stimulation as an aid in the management of chronic, intractable pain of the trunk and/or limbs, including unilateral or bilateral pain associated with the following: failed back surgery syndrome and intractable low back and leg pain. Contraindications. Patients who are unable to operate the system or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems, magnetic resonance imaging, MRI, explosive or flammable gases, theft detectors and medical screening devices, lead movement, operation of machinery and equipment, postural changes, pediatric use, pregnancy and case damage. Patients who are poor surgical risks with multiple illnesses or with active general infections should not be implanted. Adverse effects. Painful stimulation, loss of pain relief, surgical risks, e.g. paralysis. User's guide must be reviewed for detailed disclosure.